Well, which businesses do we open first? You open businesses first that are most essential and pose the lowest risk, okay? Most essential and the lowest risk. Phase one, we're talking about construction, manufacturing, and select retail with curbside pickup. They are the most essential with the lowest risk. Second phase, professional services, retail, administrative support, real estate. Third phase, restaurant, food services, accommodation. Fourth, arts, entertainment, recreation, education. Remember, density is not your friend here. Large gatherings are not your friend. That's where the virus tends to spread. That's why those situations would be down at the end. And then we need businesses to also reimagine how they're going to do business and get ready to protect their workforce, to change their physical environment to the extent they need to, and to change their processes to make sure people can socially distance, people remain in a safe environment. And that's going to be up to businesses to come up with ways to reconfigure their workplace and their processes to make this work. And that's business by business. Government can say these are the standards, but a business is going to have to figure out how to do that. May 15th is when the statewide pause order, P-A-U-S-E, not P-A-W-S, the pause order was stop all businesses, stay at home. That expires on May 15th. May 15th, regions can start to reopen and do their own analysis, but these are the facts that they have to have in place to do it. Start now. Don't wait till May 15th. Don't call me up on May 15th and say, well, the pause order expired. I want to open, because I'm going to ask you the questions I just asked, I just presented. Do you have a health care system in place? Is your health system ready? Can your hospitals handle it? Do you have testing in place? Do you have tracing in place? Have you talked to the businesses about how they're going to reopen? So we have a couple of weeks, but this is what local leaders, this is what a community has to deal with to reopen safely and intelligently, in my opinion. This can't just be, we want to get out of the house, we're going. No. Let's be smart, let's be intelligent, let's learn from the past, let's do it based on facts. The number of new infections, your healthcare capacity, do your diagnostic testing so you're seeing how the infection is increasing or decreasing, and do the contact tracing, have that system in place so when you test and you find a positive, you trace the contacts from that positive person and you're isolating them to bring down the rate. And you do that on a regional basis. We look at guidelines from the CDC, which say a region has to have at least 14 days of decline in total hospitalizations and death on a 3-day rolling average. So you take a 3-day average, you have to have 14 days of decline. You can't have more than 15 new total cases or 5 new deaths on a 3-day rolling average. Then you're watching the rate of infection and the spread of the infection. And the benchmark there is fewer than 2 new COVID patients per 100,000 residents, right? Then anticipate, protect yourself from all possibilities. Well, what if we have a surge again? Never fill your hospitals to more than 70% capacity. Leave 30% in case you have a surge. Remember, this virus is tricky. Also, learn the lessons from before. Every hospital has to have 90 days of PPE. We cannot have another mad scramble where nurses and doctors don't have gowns and masks, etc. because the hospitals don't have the necessary stockpile. So make sure every hospital has the stockpile. On the testing, we have done really remarkable work on testing. 1 million New Yorkers have now been tested, believe it or not. And the CDC Coronavirus Task Force for the White House recommends that for a region to reopen, you have 30 tests for every 1,000 residents ready to go. We have to have those tests, and we have to have what they call tracers, contact tracers in place. And Mayor Bloomberg has been very helpful, former mayor of New York City, in putting together this tracing system. This has never existed before on this scale. A group of people who literally trace contacts from a person who's positive. Who did you have dinner with last night? Who did you have dinner with 2 nights ago? Who might you have been in contact with? And then contacting those people to say, do you have any symptoms? If you do, you should know. You were with John Smith. John Smith tested positive. He said he went to dinner with you. You should be on alert. That whole tracing system has never been done, not only in this state, but in this country. So that all has to be set up.